All right, so whenever you blow and you blow your nose and nothing comes out, it feels like you don't have any mucus whatsoever. However, you still stuffed up. That usually happens when the turbinates are swollen. So inside your nose, you have three little spongy things in there. They're called your turbinates. You have the inferior turbinate, the middle turbinate, and the superior turbinate. And when they swell up, it fills up your nose, but it's usually with blood. They are inflamed. And a lot of times you can notice that happens when you lay down to go to sleep on this side, and this side gets stuffy. And then you turn around, you lay on this side, and this side gets stuffy. That is just blood inside the turbinates that are moving from one side to the other. The first thing that we recommend whenever that's happening to somebody is eliminate all allergens. What are some things that could be affecting besides all the breathing things? Well, we usually do, no fragrances, hypoallergenic sheets, humidifier or an air purifier in your room, chemicals that we use to clean the house. We gotta make sure everything is more green and not as aggressive. Plug-ins, candles, all of those things are going to help us improve the air quality. And then sometimes we do nasal sprays. Just saline is fine for us to start with to start cleaning the nose. Because whenever we are mouth breathing, we are not allowing the moisture from the air to go in the nose. If there's lack of moisture in the nose is gonna dry up, and those turbinates are also going to swell up. If we're breathing too fast, so the rate of breathing, if the air is going in way too fast, like that's gonna swell up the turbinates. We need slow and steady during rest. We need to make sure we're using the nose way more than we're using the mouth. So again, we have enough moisture, and that's when we produce something in the nose called nitric oxide. It's produced in the paranasal sinuses, and it's actually, the air has to go to the middle and the superior turbinates. If it just goes on the bottom right here, you don't get the nitric oxide production. When does that happen? Sometimes you go to an ENT and they do a turbinate reduction, where they remove a little bit of this tissue or reduce a little bit of this tissue right here, but it's only on the inferior turbinate. Like that, the air goes in and it goes straight to the back of your throat. It still doesn't go up. So even though you had surgery and it's easier to breathe, you're not getting all the benefits of nasal breathing because the air is not going to the middle and the superior turbinates where the nitric oxide is produced. Again, what can we do to improve? We can reduce allergens, we can remove dairy. Unfortunately, dairy is inflammatory and increases the amount of mucus. And then an air purifier, changing the air conditioning filters more often, all of that is going to help improve the air quality. And then of course, seeing us at MyoMoves, where we're gonna help you change the rate of your breathing, teach you how to breathe properly during rest. That's also gonna improve your breathing.